Interested in all things psychology? You are at the right place. Here, we bring exciting and thought-provoking ideas. We travel into our minds and some things out of this world. Welcome to the Psychology Debrief.
Hello and welcome to the Psychology Debrief. I am your host, Sam Fairlamb, and today we're talking about young people's mental health. I'm joined today, first of all, by Professor Helen Pote. Helen is our Program Director for the Declan Psy program here at Royal Holloway, and her research also focuses on children's mental health as well as mental health literacy. I'm also joined today by Dr. Vanita Chamdal. Vanita's research concerns well-being, particularly focusing on work-related stress, as well as incidents of trauma. She's also a practicing well-being counsellor. Thank you both of all for joining me. I hope you're both doing well today. And I guess as a kind of initial point, some of our listeners may be, a little bit confused why we've decided to focus on young people's mental health rather than just say mental health in general. Now, I assume, it's not my research area, but I assume that there is perhaps maybe some unique circumstances for young people that make sort of the expression of mental health or particular circumstances of why mental health is apparent in these sorts of individuals, different from other types of mental health. Also, maybe that they might be more, mental health might be more prevalent in these kind of groups. Is that my assumptions kind of correct there regarding sort of why we'd focus on young people?
I think there's, maybe a few reasons why it's important for young people. Obviously, like the most important thing about young people is they're still developing. So if there are going to be opportunities for change and improve mental health, this is a great time to be dealing with struggles early. And what we know from the stats, if you like, from figures in the UK and internationally, is that, for half of the people who have adult mental health problems, it's already started as a difficulty by the time they're 14. Okay, so and for 3/4 of them, it's already started as a difficulty by the time they're 24. So it's really important we catch people early, if you like, and give them the support they need if they're struggling with their mental health. And if they're not struggling, what a great time when people are learning and at school, etc., to be equipping them with, positive steps they can be taking to support their mental health, just like we, make them do PE to support their physical health. So, that's one of the reasons for me. I don't know, Vanita, whether you've had other thoughts.
Yeah, no, absolutely. And to add to that, I think kind of during that period of 14 to 24, you've got a lot of transitions happening. Post GCSE, you've got college or sixth form, or at that point, I'm not sure, kind of going out to work and so on, but then also transitioning to university. And that can be one of the biggest transitions that someone can go through, because that's where for a lot of people, they're moving out for the first time. They've got that independence. And what that can represent it can be so much, depending on what your background is from. So transitions are huge. And to add to what you said in terms of the kind of resources available in schools, absolutely, it's so important. I'm aware that within schools they are doing it in PSC or PSHE.
PHSE, yeah,
that's it. And it is valuable, because that psychoeducation is so necessary, just to kind of get that knowledge base there for individuals, for young people, to get an understanding of how it can relate to them.
Yeah. So, I mean, the fact that the difficulties are first emerging usually in adolescence, and adolescence is the time when lots of new challenges are arising, is perhaps no coincidence, so we need to think about what are these young people struggling with and how is it contributing to their mental health. But also, for those with some really serious mental health problems like psychosis, schizophrenia, those sorts of difficulties, they really start emerging sort of 18, 19. That's a really common onset time, as we term it. And so we need to make sure young people are already thinking about mental health so that, you know, they're not completely shocked if some things start going awry. We know, like, things like CBT, cognitive behaviour therapy, and other things can be really effective for young people in a preventative way, from you know, stopping things becoming more serious for them. So yeah, I think catching people at the right time feels important. You know, there's a lot of stuff in the press at the moment about a mental health crisis for young people. And, you know, every newspaper will have something that says, you know, mental health problems are worse than ever before. I think when we look at the stats on that, actually there is a small increase of a couple of percent in terms of prevalence over the last 20 years. It's not a huge increase. It's mainly accounted for by young people, particularly young women, becoming more anxious, experiencing more symptoms of anxiety. But I think what is different, and we'll come on to it later, is perhaps the support and services aren't really meeting young people's needs. So actually the crisis is we're not supporting people early enough.
Yeah, no, absolutely. And then just to kind of add on to that prevalence element, I feel that we've got the resources now to actually pick up on the symptoms, and to pick up on the stats almost. You know, I do wonder whether those stats would have increased in that way if we use the same resources that we have now, you know, maybe 20 years ago. It's just that maybe the resources weren't necessarily there, and whether we'd you know, it's just the fact that we're actually picking up on it now. People are kind of, they are aware, they are kind of saying, actually, hold on, this isn't something that is healthy, I need to do something about it.
Yeah.
And the fact that we have kind of the media that's available now, it's not just limited to you know, what you see on the news or the newspapers. It's on our phones, and we have access to it in every single platform that you can think of. And so how it's reported as well, it's a biggie, absolutely. But in terms of also the resources that are available, and kind of the support that's available for these individuals and for young people, the way you work with an adult therapeutically is very different to how you work with a young person. The way that the narrative is in kind of that therapeutic space, there is a contrast. Absolutely. So there is a requirement to also take that into account.
Yeah, I mean, I think these are some great issues that you're kind of touching on. I think some of them we'll return to in a little while when we look at sort of things like mental health literacy and obviously getting help as well. I just wanted to pick up on something else that sort of Vanita mentioned about young people and it being a kind of turbulent time where there's lots of change. And obviously you mentioned university as one of them. And you know, some of our listeners obviously may have just joined university or be at university right now. And obviously that is one significant life change, but you know, generally speaking, I think there's a large number of changes that are going on. And just to kind of add one extra to the mix that I had a thought of based on the kind of research area that I do. And I think at least, you know, from my perspective, when I was growing up, I think it's, you know, an issue here is about trying to find a sense of meaning and purpose with your life. And I think it's very, very difficult when you're young to try and kind of get a confident blueprint about what you're supposed to be doing and feeling like, you know, you are going to make a kind of valid contribution. I think that's especially difficult at a young stage. And I think as you kind of grow older, you start to find that kind of sense of purpose more readily. But I think maybe at a young age, I think that students and I think young people can often struggle with that kind of sense of, you know, a clear purpose, a clear sense of a carved out role in society. I think that's a kind of another potential issue that maybe young people particularly face in comparison to, say, older individuals who have started to develop careers and so forth, and they feel like they have a valid and valuable contribution to make. I just wanted to move on to our next question then, and I guess we've already started a little bit, unpick this a little bit, but you know, what exactly are the kind of things that contribute to the difficulties that young people face? What necessarily are contributing factors to the mental health problems in young people?
Yeah. it's a complex picture, Sam, as I think you point out. I mean, if we knew, you know, sort of causally what things were definitely leading to mental health problems, we'd be in the literature and the support we could offer would be in a much better place. But I think for me, the best way to understand it is like a complex interplay of risk and protective factors. That the risk factors being sort of additive, you know, if you added them together, it might contribute to some difficulties. So the sorts of things we know from the literature contribute to mental ill health, if you like, or difficulties with one's mental well-being are sort of, you know, special educational needs, for example, is a big one. If young people have sort of cognitive learning or communication difficulties. You know, other things can be having parents, for example, who've struggled with their own mental health difficulties, problems in their peer relationships, bullying. All these individual risk factors have been studied and are known to contribute to in a group way to you know, common mental health problems. That's not to say that everyone with those life experiences or difficulties will necessarily go on to have a mental health problem, but it just puts them more at risk of that. I think, you know, in addition to that, a lot more recent research has looked at things in the social environment, like in the school and neighbourhood environment, like experiences of discrimination, racism, poverty, etc., that might really be playing into some of those individual factors. And so we can't just look at a young person and the factors for them themselves. We have to think about them as part of their, you know, family and school and neighbourhood community environment and look what's going on as a whole.
Yeah, no, absolutely. I definitely agree with that, particularly in the socioeconomic element, because there is a lot of research around this in how, you know, what the literature is saying in terms of that almost an imbalance of the resources which are available for communities or areas, even within the UK, where there isn't, it may be kind of a lower socioeconomic background versus higher. And the reporting or the prevalence of mental health issues is a lot higher for socioeconomic backgrounds. And it can be down to resources or lack of resources that are available. It can also be down to the support that's available, not only for the young person, as you've just said, but also kind of for the family, because as we've kind of touched upon briefly, whilst the young person is going through their life transitions, it very much kind of is based on kind of the family background as well. So the support that is available within kind of from parents or siblings or friends and family, and kind of how they've been able to transition as they've been growing up. So it's quite kind of core and pivotal in terms of the support that's available very early on. And even in terms of, I was reading a study not long ago on how GPs going into schools and delivering psychoeducation and delivering that knowledge that's available just normalizes that narrative that's available for students or for young people. And that helps kind of eliminate, not quite kind of eliminate, it kind of reduces that stigma that's associated, and it reduces that kind of narrative of nothing will help, which seems to be kind of a lot on kind of the lips of young people. I've got this is going on, nothing's going to help because this is what normal life is and this is how they perceive as normal life. So having professionals there that say, actually no, like, you know, there are things out there that can help you and they're tailored for young people, can really help individuals see kind of that light at the end of the tunnel almost.
Yeah, and I think that's a really good point that kind of leads to the next issue, because you mentioned obviously sort of GPs going in and raising more awareness about mental health. You know, it can maybe alleviate some stigma around it, and obviously therefore it kind of contributes to this issue of sort of mental health literacy, which Helen, I know that you're a kind of keen, avid sort of reader and researcher in. So Can you just first of all explain what we mean by mental health literacy, and then obviously how does necessarily things like stigma sort of fit into what we mean by that term?
Yeah, I suppose this idea of mental health literacy, sometimes people call it mental health awareness, started by a psychiatrist in Australia called Anthony Jorm, with this idea. You know, we all sort of develop knowledge of physical health difficulties, and we all have like a responsibility in a community and families to be, you know, noticing if people are showing symptoms. Someone has a cold, we express concern, we know the sort of early signs, we'll know some sort of likely helpful interventions, and we'll direct them to the right place for resources. Parents do that all the time, you know, with their own kids. And to think like, well, why aren't we doing that for mental health? Why aren't we having more of a community focused health promotion approach to mental health? Why aren't we all as a community more knowledgeable about mental health problems? What are the common signs and symptoms, so that we can recognize difficulties early? Why don't we equip ourselves as in families and schools and communities about common interventions that can help with those difficulties? The reason being is that we know if people get the right help early enough, it's likely to prevent further or more significant or more serious difficulties. So we can like support people in our communities to getting that right help at the right time. And this has got translated into the whole idea of mental health first aiders, because every organisation has a physical health first aider. Why aren't we offering the same sort of support for mental health? So I know even in at Royal Holloway, that's been a big initiative in the last few years, is to get members of staff trained as mental health first aiders so that they can support students, and students can feel comfortable that staff will know and understand their difficulties if they talk to them, and can direct them to some early help. So it's that idea that we equip ourselves as a community with knowledge about difficulties and symptoms of difficulties, with knowledge about interventions. And what's been shown in the literature is if we do that at a community level, then some of the stigma reduces around mental health. Some of that worry about saying to people, I'm really struggling. And I'm not just talking about saying, oh, I'm having a bad day today. I'm talking about, you know, people who are really starting to struggle with difficulties, but feel too ashamed or too frightened about discussing that with people in their community who could support them. So that's the idea behind it. And I've been taking that forward in schools, really, as well as a bit at the university.
And I think this issue about stigma, just to kind of follow up on that, because you sort of said about how obviously increasing mental health awareness can reduce stigma, but I suppose particularly that might be an issue for men, because sort of traditionally, you know, men are often sort of socialized to not really talk about their emotions, supposed to be kind of very strong individuals. So I suppose some of the strides that we're talking about here can be very impactful for maybe these kind of individuals, sort of young men. Is that the case, or is it also very just broadly useful for sort of both genders?
It's been shown to be useful for both genders, because I think there's maybe differences in the way that people express their distress, you know, between men and women. But you know, every individual is different and expresses, you know, their difficulties differently. But traditionally, sort of, you know, young boys, for example, were often expressing their distress behaviourally. You know, they were acting things out, whereas women and younger women tended to be expressing that, I guess, more emotionally, and sometimes turning it in on themselves as well, and you know, through issues of self-harm, etc., expressing it in that way. So the idea behind mental health literacy is about helping people in the community understand the different ways that people express their distress, be that according to gender or age or class, their sort of ethnicity, however that might be, for example, that's affecting that. But I think maybe for men it is a particular issue. There's been quite a few studies with adults, not so much with young people, but adults, where they've done mental health literacy interventions with like traditionally male environments, like in the police, and shown that to have really positive benefits for reducing the level of difficulties and reducing stigma.
And of course, I suppose we're talking about mental health awareness, mental health literacy, and obviously you mentioned that Royal Holloway and I presume other universities and other organisations try and increase people's knowledge about mental health signs, early warning signs, and so forth. So for those who are interested in maybe learning more about early signs, are there a couple of early signs that maybe we could just give to our listeners so they can have a bit more an understanding about maybe, for themselves, whether there might be some underlying mental health difficulty, or maybe they might recognize it in their friends and they might be therefore able to help support them or direct them to support more appropriately?
Yeah, no, of course. I mean, in terms of generally speaking, and general kind of mental health awareness, it's when there's kind of a presentation of behaviors, emotions, thoughts, which are out of character. And that can be something that's progressive. It doesn't necessarily have to be, next day you wake up and you're feeling more upset than usual or feeling more low than usual. So it can be something that kind of goes on over a certain period of time. And just being aware of that within yourself. And as well with others, it can be easy to pick up on, if your friend, for example, normally is really excited to see you whenever you all meet up, but then lately that they've been quite withdrawn and so on. So it's about picking up on these cues almost. But then also it's about being kind of aware of your. So it's also being aware of your well-being and noticing kind of changes within others, but then also when there's been any kind of significant change within your life, anyone's life, because even if it's a positive significant change, it can still have kind of negative experience, kind of connotations on your life, because it can sometimes lead to changes in kind of your lifestyle, and that can snowball into other kind of unhealthy habits, for example. So that's kind of just very generally kind of speaking about how you can build on your awareness. And I always find that kind of building on your self-awareness is like a superpower. Once you're able to work on that and you're able to work on that skill, and it is a skill, it's not something that you can kind of just kind of get over the course of a couple of days. It's once you're able to work on that, it opens up a whole new world of understanding what's going on for yourself, but also what's going on for the people around you. So that's kind of generally speaking about mental health and well-being. I mean, Helen, I don't know how you've got.
I think that idea, Vanita, that you're picking up on in terms of a change. I think change is a good word to use. So if you've got someone who's a friend, who's normally socially very outgoing and becomes more withdrawn, you should, listen to your gut feeling about that. That doesn't seem quite right. And just be curious about it and follow up with them, ask them a few questions. How's it going? Rather than just think, oh, they're not really wanting to come out too much at the moment. Maybe sort of offer to start a conversation with them about how things are. But the other thing is about like life events. So there are some really common life events that are happening for young people. One, as you point out, is like leaving home, really stressful for some people, which can be a big trigger. So offering people more support, trying to include them more in things, inviting people out to make connections. Social connection is really important in helping support people's mental health. So if they are struggling to make that leap of making new friends at university, you know, be kind and extend some of your invitations to them. But there are also other common things that are happening for young people, you know, like bereavements, death of a grandparent or parent at this sort of stage that's really common and really can trigger for some people some very difficult emotions that they've never had to cope with before on their own. You know, other common life events or changes that, you know, are sort of separations with partners, splitting up with partners, really common, really significant, and can often you know, seem on the surface not to be that important relationships, but for some people it can really trigger earlier losses that have gone on in their life. So we can never assume that, you know, just because they weren't that close to that person, it's not going to be a really significant event for them. So just to keep an eye out on what like life changes are happening for people that we know can be difficult, but also noticing I as a psychologist, you know, the way we break it down is think about people's behaviors. Have you noticed a change in their behavior? Like, are they suddenly going out more, suddenly spending loads more money than they would, or suddenly not, you know, not going out at all? Is there a change in their emotion? Is the second thing, you know, so are they sort of easily irritable, or is it more tearful than normal, or more impulsive than normal? And is there a change in their thoughts? So often people who are starting to struggle with mental health difficulties, it might be that they're sort of talking about themselves in a much more derogatory manner, or talking about the fact that they're, you know, life's going to be like this forever in quite a hopeless manner, and that they sort of their descriptions become a bit more negative about the world and themselves. So they're good things to look out for. And if, as I say, if you do notice those things, spark up a conversation. If we see this as a community responsibility, you'd hope that if you were experiencing that, people would start sparking up a conversation with you about it. How are you feeling? Are you okay?
Yeah, and I think that's a really kind of important point to note, that you mentioned that, you know, typically we might kind of characterize mental health problems as this kind of sense of withdrawal, isolation, quieter, sort of depressed sort of sense. But you did note that it can also be the kind of opposite. People can behave more, I don't know, I guess gregariously and more overtly, you know, maybe wanting to go out and do a lot of drinking and so forth. That's another way that people might, you know, sort of self-medicate, for example, through alcohol. So I think it's a really important point to kind of, you know, realize that maybe the ways in which people express those mental health difficulties can be different. I also really like the point that you mentioned about just asking, and also just the fact that, you know, this mental health crisis, if we want to call it a crisis, because generally mental health problems that people have is a community issue. And I really like the idea of just asking people, you know, are you okay? I think, you know, whilst, you know, it might be a bit, you know, over the top to sort of say that that can have really, really profound impacts upon, you know, how somebody feels. Nonetheless, sometimes people can get into those kind of thought processes where they think people don't care about them. And so, you know, even just a simple question might have quite a powerful impact. But, you know, regardless, you might help that individual get to the kind of sources of support. You're not probably going to be able to, you know, alleviate their depression through a simple question, but by starting that discussion, you might help that person kind of get the kind of help that they need. And so, you know, I think that's a really good point. And it also leads us on to the kind of final point that we want to discuss, which is what kind of support can, you know, people have access to. There are various types of mental health provision, and perhaps maybe, you know, because of the large supply, the large demand, it's often difficult to meet that demand. But nonetheless, it's probably useful just going through the types of support that is available to young people if they're having mental health difficulties.
Yeah, I mean, if we say there's about 1 in 8 young people of this sort of age, 14 to 24, that are having mental health problems, you know, like less than a quarter will actually see a mental health professional. There's just not enough mental health professionals to go around. But, you know, actually not all of them need to see a mental health professional, you know. So I think friends, family, teachers or lecturers are like our support bubbles, if you like, to start with. So starting off with thinking about who in your own networks can offer support is really important. I don't know, Vanita, whether you've experienced that.
Yeah, no, of course. I mean, you got me kind of noting down, you know, the hierarchy of needs is a good kind of place to start. So, you know, kind of having a look at Maslow's hierarchy of needs, you know, the triangle, and just kind of looking at whether those needs are being met. You know, you're not necessarily needing to kind of get to that top, so to speak, but just kind of having the basics there as a good foundation, and then kind of building that on with a good support network which kind of encourages healthy kind of coping or a way of life. But then also in terms of the kind of resources that are available, and something that's really important that I kind of thought of as we were speaking was, you've got some brilliant resources available, like, yeah, available online. So you've got kind of the NHS website, you've got mind.org, you've got Mood Gym. So there's loads of resources that are kind of supported by the professionals that, you know, 100% use, because if they've got the information available for someone who doesn't know anything about that, you know, about depression, about anxiety or so on. But to be really, really careful as well on other resources that are available. So for example, you've got social media where anyone can post anything. So it's really, really important to be aware and cautious of where you are getting your resources from, where you are getting your information from, because I've seen some kind of TikToks or these videos of people who, it's obvious that they don't have any credentials, and they're giving advice on how to diagnose with anxiety, and it's just, it is alarming for a healthcare professional. It is alarming for someone who is trained in mental health to see this information that's out there to the public, to young people. So yeah, just be really aware of where you're getting the info from, but just it's really important to know that there's loads of information available. So just have a look at the kind of websites that you're looking at. But also, if you are wanting to seek that professional support, talking therapies is a brilliant place to start, and that you can self-refer. You don't even have to go to your GP, but if you feel comfortable to do so, you can go through your GP. And access IAPT, it's improving access to psychological therapies. So and that's on the NHS. It is something which you've got available to you, you know, based in the UK.
Can I add into that, Sam? I think what Vanita's really emphasizing it, which is like a great principle for any psychology student anyway, is like make sure there's an evidence base behind what you're looking at. So in the field of mental health, we really focused on evidence-based treatments, and in the NHS totally. So, you know, we know some treatments like CBT, like some aspects of family therapy, can be really helpful for common mental health difficulties like anxiety and depression and eating disorders, which are like, you know, top big three for young people. And make sure that the resources you're reading are informed by practitioners that are supported by having that sort of training. Mind is a great website, as Vanita said, but if you're unsure about exploring some of these things, you want to look on the NHS. There's fact sheets on the NHS for everything. And there's also a great apps library of apps for mental health. So sort of apps you can use on your phone and on the computer that have been evaluated by the NHS and are being trialled within NHS services. So you know that you're not just like Googling and finding something that hasn't been really well researched. And they've also passed like the more stringent tests for confidentiality and security of your data, for example. So I would really advise people, to go onto the NHS website, look at their apps library, look at the Mind website. There's also Young Minds as a branch of that. And we've been developing some resources in the department as well. I've got an app called Mind Aid, which we're trialing, which just looks for young people to how to start having some of those conversations about their mental health, and gives them pointers to talk to young people, talk to their peers, talk to teachers, and to ask questions of others as well. So there are lots of things out there that are useful. I'd say, I mentioned that, like, friends and family are helpful. Sometimes it can feel like, my friends just wouldn't understand, or my family don't really understand me. And it might be you want to just talk to someone completely anonymous. We have a great counselling service at Royal Holloway, and most, any sort of educational institution these days worth their salt will have a good counselling service, which is self-referral, completely confidential. So that's a really important starting point if you're a new student at Royal Holloway, for example.
Yeah, I get the sense from what both of you are sort of saying is that, there are lots of different sources of support out there. The kind of key step that someone should first of all take is looking for them. And I think maybe just broadening your horizons about what necessarily help entails. Mental health professionals are limited, as you mentioned, Helen, but not necessarily is it always the case that people necessarily need them. There are lots of other ways, but obviously, as Vanita mentioned, do make sure that you are, checking that the information you're getting is valid. So going to kind of reliable websites and apps that you suggested, Helen, which is a great idea. Okay, so we're almost out of time. So I guess just very finally, it's been really interesting to listen to both of you, and maybe at some point we'll have to pick this back up again and go a little bit more deeper into mental health, particularly in young individuals. But is there a kind of final thought that maybe you both want to sort of leave our listeners on, maybe just a kind of key message or anything else that you want to add to what we've already discussed?
Yeah, I suppose the only message I have is that over the years working with many young people, at the point that they're struggling with their mental health, it feels like things are particularly hopeless. It feels like there's going to be no end to this for them. And that can be a really hard thing to feel like you're the only one, like this will go on forever. And at some points when that happens, people can feel suicidal. And I just suppose I wanted to say to people, it's really important they reach out and talk to someone, whoever it is, a friend, a family member, a stranger, a lecturer, if they're feeling like that. Because what I've seen over the years is that, that really can turn around, and the resourcefulness that young people have inside themselves is really incredible. And change is really possible. So I suppose it's just a plea to anyone who might be listening to this and feeling like that, to try and make some sort of reach out, and for the people who are in Royal Holloway community to listen to that. And to support other people, because Vanita and I have both seen incredible change in young people, incredible resourcefulness in them over the years in making changes.
Yeah, no, thank you for that, Helen. And not to necessarily piggyback, but to echo what you said, that is something that's really important. The narrative of nothing will help is something which you hear a lot with young people, especially those who are struggling with their mental health. For some it's been for a short amount of time, for some it's been for years and years. And believe us when we say the resources are available, and the professionals are available to help and support. So absolutely seek out, whether it is going through your GP, whether it is speaking to teacher, lecturer, friends, anyone, the power of talking, you really can't underestimate it. So yeah, absolutely reach out. And for those who may be noticing changes within others, reach out to them, because as Helen put, really nicely earlier, how the power of saying, "Are you okay? Is everything okay?" Or so on is something that's really powerful for someone who needs it. So yeah, talking is never a bad thing, and to absolutely exercise it whenever you can.
Yeah, and I think that's a really nice thought to leave it on. Talking is never a bad thing. Just that's always the first step on sometimes a long road to feeling better. But as Helen pointed out, even though it can feel like it will go on forever, there is always hope at the end of the tunnel. And I think that's probably a nice point to leave it on. Thank you both very much for taking the time to speak to me and engaging with our listeners about mental health. I really hope that maybe at some point in the future we can have a similar topic about this, and you'll be happy to come back and share more insights.
I love to.
Brilliant. Thank you very much. And obviously, if any of our listeners have any suggestions for topics or anything else that they want to get in touch about, then you can tweet me at the Psychology Debrief, as well as you can also reach me on Gmail as well, the psychologydebrief@gmail.com. Okay, thanks both of you, and I'll look forward to hearing from you again. Okay, bye.
Bye.
Thank you for watching the Psychology Debrief. If you have any suggestions for new topics, quizzes, or any other content psychology related, feel free to get in touch via email or Twitter. Don't forget to like, share, and subscribe. Bye!